As you all know, March is Developmental Disabilities Awareness Month, and we must ensure that persons with developmental disabilities and their family caregivers have access to programs and services in their communities and are included in the same way persons without disabilities are. Today's panel will offer an overview of different programs and services for Fairfax County residents, followed by a brief Q&A before we open it to you, the audience, to submit your questions to the panel through the chat box. A few housekeeping rules before I introduce our speakers. Today's presentation is being recorded, and our recording will be sent out to all of you by early next week. Now, mics and cameras will be off. Please do not unmute yourself or do not turn your camera on. Also, at the end of the presentation, there will be a brief survey. I will paste the link in the chat box before you leave. So if you could please take a moment to click on that link and give us your feedback. Right now, I'm going to introduce our panelists. We have 5 speakers with us who are leaders in their field and who will provide guidance and information on different programs and resources regarding people with developmental disabilities and their family caregivers during this pandemic. Our first presenter is Claudia Villa, who is the manager of the Disability Rights and Resources Unit in Fairfax County Department of Family Services. We also have Cindy Dalhoff, who is the manager of the Therapeutic Recreation Services at Fairfax County Neighborhood and Community Services. Sierra Simmons is the service director for the Fairfax Falls Church Community Service Board. Melissa Graces is a self-directed services specialist with Fairfax Falls Church Community Service Board in the Self-Directed Services Program. And Lucy Bidnell is the Director of Advocacy at the ARC of Northern Virginia. Thank you to all of you for being here with us. And now Claudia Villa is going to lead us into this conversation. Welcome, Claudia, and thank you.
Thank you, Juliana, and good afternoon to everyone. I'm very excited to be here and provide resources on what we do. So I'm Claudia Villa. I manage the Disability Rights and Resources Unit within the Department of Family Services. So if we could go to the next slide, please. So just a quick overview of what our unit does. We are tasked with providing referral and technical assistance to our disability community. And this is sort of an important distinction to remember. We do not provide direct client services. So if you contact our office, what we will do is we will intake your case and determine the most appropriate agency within the county or the most appropriate nonprofit to refer you to. And we provide some general support around 4 core areas, and those are listed here: employment, housing, transportation, and emergency preparedness. Even within the various different core areas, we don't just provide referral and technical assistance, we also host a myriad of initiatives. So for our employment area, we have a summer internship. It's a paid full-time internship for college students or recent college graduates with disabilities, called the John Hudson Internship Program. And what we do is we partner the students with a county mentor, and they spend a summer, about 2 to 3 months, working with that mentor, obtaining some hands-on experience and also getting an understanding of what it's like to work for the county. And we've been doing this for about 10 years. I'm happy to say several of our interns have gone on to be offered employment with the county. Housing is one of the areas that we receive the most calls in need of assistance. So a lot of folks contact our office looking for affordable housing. Some individuals call our office looking for accessible housing, sometimes both. And although we don't provide direct assistance in your search for housing, there are several platforms available to you to start your search. Our office has also put together 2 lists, an affordable housing list and an accessible housing list, within Fairfax County that will give you a good starting point as you search for housing. And one of the really great things about these lists is that, particularly with the accessible housing list, one of our staff members has gone to all of the apartments listed on this list and has done a visual inspection to make sure that they do in fact meet some of the minimum standards of accessibility that someone who, for example, uses a wheelchair would need from their apartment. So these are some of the services that we provide, in addition to just providing you with referral assistance and some technical assistance on how to do self-advocacy within the confines of the Americans with Disabilities Act or the Fair Housing Act. Next slide. Another thing that we do is to provide staff support to the Fairfax Area Disability Services Board. This board is comprised of 15 volunteers from Fairfax County and the cities of Falls Church and the city of Fairfax. And they, although my unit provides assistance to anyone that calls us regardless of disability or medical diagnoses, this particular group that we provide staff support for advocates for people with physical and sensory disabilities. And just to put in a little plug, we are actually in the process of looking for volunteers to serve on this board. So if you are interested, please contact our office and we'd be more than happy to point you in the right direction as far as how to apply. And then last but not least, we also manage 3 contracts with local nonprofits, which means that we partner with them to provide services to the community. Those groups are listed here: the Northern Virginia Resource Center for Deaf and Hard of Hearing, also known as NVRC, Legal Services of Northern Virginia, and Brain Injury Services. And so with these 3 partners, we have them put presentations to the community, informational sessions. NVRC does hearing screenings for folks who might feel like they need hearing aids or some sort of auxiliary aids. And they also conduct trainings within county so that county staff are aware of the needs of these particular communities and how to best work to advocate for those members of Fairfax County. Next slide. And so we have, last but not least, I've included my contact information. I believe Juliana is going to be sharing this PowerPoint presentation. So if you have any questions or would like to contact our office, you have our phone number and our email address. Access Fairfax is actually our bi-weekly newsletter where we provide disability-related information, whether it be from the county, state, or federal government, just so that you have some resources available, particularly during COVID. So if you are interested, I definitely recommend that you subscribe to Access Fairfax, and we have included a link here. So thank you, everyone, and I look forward to our conversation in a few minutes.
Thank you, Claudia, for that presentation. And now we're going to move on to Sandy Dalhoff.
Good afternoon, everybody. I'm Sandy Dalhoff. Like Juliana said, I work in Therapeutic Recreation Services, which is under the Department of Neighborhood and Community Services. So what we do specifically in Therapeutic Recreation is we provide a variety of different programming and supports within the inclusion environment for individuals with disabilities to have access to the recreation and leisure opportunities of their choice. We provide some contained setting programs specifically for individuals with disabilities, as well as support inclusion throughout all of the community centers, senior centers, and teen centers that the county operates. During the pandemic, we have switched to an all virtual model. Our virtual programming has been divided up by age group. Traditionally in the normal year, we serve individuals ages preschool through seniors. So we do the whole continuum, as well as serving individuals with a variety of disabilities, including developmental and intellectual disabilities. Beginning of April, so next week registrations for these will go out, is our next round of virtual programming for our adults We have adult social clubs. We have virtual fitness programs called Tone It Up Tuesday, as well as we're starting a service learning program. And there may be some special events along the way. For our youth, we have programs for school-age individuals, so 6 through 22, where it's a variety of kind of social activities, an opportunity for them to connect, fitness activities, games, brain games, kind of the whole gamut, just an opportunity for folks to get together. And then for preschoolers, we have an interactive 25-minute session for kids ages 2 to 5, and those are kids with and without disabilities. And we just ask that the caregiver be present to kind of co-lead that, because it's really difficult to keep a 2 to 5-year-old in front of the computer for 25 minutes without support. So we have been doing a variety of virtual programs throughout the pandemic, and our next round, like I said, will start during spring break. We'll advertise, and then after spring break is when those will begin. If you are interested in learning more about those, there is a link to our website where we will have those programs updated as soon as registration is available, as well as at the top of this slide, you'll see our email address and main phone number. The main phone number is answered from 8 to 4:30 every day. So there's plenty of people that would love to give you more information or help you figure out the right fit for the individual that you're looking for. So this slide shows what we do, recognizing that virtual programming is not for everyone. More importantly, with this population, it's not the right fit for every individual with a disability to engage virtually. So we have also done, seasonally, we've done activity bags, and in those bags is like 2 weeks worth of activities. It's everything from, themed craft activities, scavenger hunts, word finds, as well as manipulatives, different sensory items, and other activities that folks can participate in. And what they'll do is like twice during the week, they'll get together via Zoom to share activities or to do an activity together. Those bags are in the midst of being given out now. So we have them for preschoolers, we have them for youth, we have them for adults. And then we also have, we did a Sunday Bites family cooking program. So for folks that were enrolled in that program, we have a chef bag available for them. If you are interested in those and have not signed up yet, please call the office or email us, and we can let you know where there's still availability and send you the Zoom links for those. I believe the preschool bags have all been accounted for, but there may be some youth and adult bags still available. So please contact us and we can try and get you signed up and get you one of those. And those are just a great way for families to have an opportunity over spring break to engage individuals, just something new and different. Some of them can be family ideas. We've got some siblings that participate together, as well as ones that they should be able to do more independently to pass the time and stay engaged. The next slide. The other things that I wanted to talk about, so while Therapeutic Recreation does programming specifically for and with the needs of individuals with disabilities in mind, one thing that we also do is ensure that there's inclusion opportunities available throughout the agency, and we work kind of cross-agency to make sure the same things are happening. And some initiatives that came up during the COVID-19 pandemic is the opportunity to do some collaborative virtual programming. And so what you have here is there's the Virtual Center for Active Adults, and it was specifically called Active Adults, not the Virtual Senior Center, to make sure that it was inclusive of adults with disabilities. So on here, there's like 10 plus live activities a day, everything from Tai Chi to yoga to dance fitness, Zumba, chair exercise, sail programs, to also your social programs, your games, your cooking, your special events, your arts. We've got caregiver groups on there. So there is just a ton, and it's all free, and it's all, if you go to that website, you can see a whole calendar. There's also that website has a variety of other opportunities or resources for adults with disabilities in Fairfax County. NCS Connects is kind of that partnered youth opportunity. So we've got therapeutic recreation staff that work with the community center staff to provide a variety of after-school activities for youth. And on both of those sites, there's also on-demand activities that you can kind of go to and participate as it works in your schedule. And then the last piece on here is I just wanted to reference one group in our agency that's been pretty prominent during the pandemic is our coordinated services planning group, where they provide basic needs and emergency assistance. So if you or any families you know are struggling with housing or with any resources that you may need, employment, there's I think 50 social workers now, they've had to add more, that are available to take calls, provide referrals out to nonprofits, help make connections, and support families who need that support right now during the pandemic. And they have been taking calls like crazy and doing what they can to support families. So just wanted to make sure to include all of those resources because they've been great resources. And I think that this, if one thing, this has brought agencies together and people together to try and collaborate a bit more on how we support all youth, all adults, and all older adults within Fairfax County. So that's all for me.
Thank you so much, Sandy. Now we're going to move on to Sierra Simmons.
Good afternoon. I'm Sierra Simmons. I'm the Service Director for Developmental Disability Support Coordination Services. Support Coordination Services serves individuals who have been in long-term institutional care and have transitioned into community settings, or individuals or adults with a DD diagnosis. Prior to 2016, we provided only services to those individuals with an intellectual disability diagnosis. But due to the Department of Justice settlement agreement with the Commonwealth of Virginia, in 2016, we became the single point of entry for individuals with a DD diagnosis needing support coordination or targeted case management services. Next slide. Lines of services that we provide in support coordination are intake assessment and eligibility determination. For these services, we do our own internal intake and assessment. So individuals looking for disability, developmental disability services should go through our internal intake process. We provide targeted case management. This is a intense service provided to those individuals who have a developmental disability waiver funded by the Department of Behavioral Health and Disability Services. We offer school transition. We have support coordinators who work with individuals and families in their last year of school to help them transition from school services to adult services, assisting them in finding employment after they graduate from high school. We also have monitoring. Monitoring is my largest line of services, and these are individuals who are either waiting for a developmental disability or accessing local funds for services. Next. This is just kind of an overview of the service population. We currently serve 1,490 individuals with a DD waiver. We have 3,573 individuals in monitoring services. And at any given month, we have about 400 people who are in assessment and intake. Next slide. We have a large department. We have quite a few staff to support all of the individuals we support. Targeted case management, what we do is we coordinate services. We coordinate, link, and monitor services for individuals in the community. So we don't provide any real service, but we coordinate, link, and monitor services in the community. So if somebody was interested in residential services, employment services, community engagement, or any kind of service that is needed, we would assist in coordinating and linking individuals to those needed services. Next. This is my contact information. In here, I also have a link for navigating the DD waiver. So if anybody's interested in learning more about services provided under a DD waiver, or wondering which DD waiver would work best for you or your loved one, here is a link to get to that. We also, at the top, I've provided our intake number. So you would call 703-324-4400 and request an intake support coordinator. Again, what we do is we link, monitor, and coordinate services in the community.
Thank you so much, Sierra. Now we're going to move on to Melissa Gracies.
Hi, good afternoon, everyone. As Juliana just said, my name is Melissa Gracies. I work with the Self-Directed Services Program within the Community Services Board. Self-Directed Services is a program that is funded by the County of Fairfax. We're not a licensed program through like Waiver or through the state. We're actually run just in Fairfax County. So our funds come directly from the county. And the baseline of Self-Directed Services program is that it's a community-based program, so all services need to be provided within the community. It's a very flexible program, which is wonderful for people who don't necessarily fit in boxes like oftentimes with some services are very just standardized. But families can really choose to customize the services that they receive based on what is going to be meaningful to the person receiving services. Some examples of how people use funds, we have a lot of graduates that come in that go to either College Steps program, Mason Life program, or the Massey program. And they're able to use funds to pay for those supports within those college programs. They can also hire individuals that they know directly, such as a neighbor or a friend. It can't be a family member. And they are able to hire that person to take their loved one into the community for volunteering opportunities, job searching, resumes, just activities, increase social skills, pretty much whatever is really will meet the needs of the individual. And we've, based on COVID, because of the fact that this program is a community-based program, it has definitely been challenging through COVID. Families aren't wanting to go into the communities. They don't feel safe going into the communities or even having providers interact with their family members. So we have put in some temporary policies in place for some of the things that family members were requesting, such as online interactive programming so that people can have time during the day. Say if they had a companion that would take them out into the community, but they're not doing that at the time, they could do a Zoom call with the companion or play an online game with them or do some sort of online interactive activity with them. We also allowed for walks within the neighborhood. Previously, your immediate neighborhood was considered your residence and services cannot be provided within the residence. So we expanded on that as well. And then up to 1 hour a day of just a car ride without ever actually necessarily going anywhere. So we put those temporary policies in place to assist with families to still try to provide some sort of interactive activities for their family members receiving services. We have, as you can see, our mission statement on the slide there is just, really talks about how we're trying to allow people and give people the supports that they need to really be able to participate in activities in the community. Can you hit the next slide, please? This is my contact information. We do presentations regularly for anybody that's interested in accessing self-directed services. Oftentimes people who are either on a wait list for getting a waiver opportunity will access self-directed services. The amount of funds that can be provided each year is $18,084 as a maximum annual fund amount. So it's a great program for people that need skill building or activities, socialization, if they have any kind of psychological, physical, social barriers that they need support to really fully access and be engaged in the community. It's a great program. So this is my contact information. If you know of any families that are interested in services, reach out to me anytime. And what we will do at that point is schedule a presentation directly with the family to go over in more detail what the program involves and see if it's something that would be beneficial and appropriate for them.
Thank you so much, Melissa. That was really great. Our next presenter is Lucy Bidnell.
Hi, thank you all for having me. There we are. So I work at the ARC of Northern Virginia, and we actually have a birthday coming up right now. So it's no longer more than 57 years, it's more than 58. And we work to make sure that people with developmental disabilities have a life like yours. So that means make sure they have access to a good life in the community, the same things that are important to everybody else: jobs, homes, friends, relationships, those kinds of things. Go ahead with the next slide. So our mission comes in two parts. And the first part is really promoting and protecting human and civil rights. And that ties in with the second part, which looks like it's trying to come onto screen now, which is working to make sure people with developmental disabilities have a full life in their community, which gets to the heart of what we're talking about here, right? So we do that in a number of ways. So here are our core programs on the screen, and most people first come into contact with us through our information and referral. So 24 hours a day, we have a website where people can submit just a handful of bits of information in what we call our information and referral portal, and they'll get an automatic reply with quick links to kind of the most common answers about housing and education and quick kind of things so that they don't have to wait. But then staff, who is me, follows up with them and says, like, here's a more in-depth answer to your problem. Come back to me as you're working through this. Let's troubleshoot. And we do all that for free to make sure that families can find what's out there and troubleshoot and navigate it. And when Department of Family Services was talking in the beginning about saying, like, we can refer you to places, but we don't find the housing for you, that's the similar category that we come in. So people can come to me as many times as they want with many questions as they want. And I am happy, truly elated to keep helping them problem solve and troubleshoot and work through things, but I can give them the information and they have to do it. And if we get to a point where a family says, like, I really need someone to help me do this or to do this for me because this is a lot, then we refer them to some other folks who can help them do that. We do a lot of informational workshops. Our website has a huge resource library with what we call family-friendly language documents. So things that are mostly 1 to 2 pages to give people a good sense about things like navigating waivers or Social Security or those other kinds of really common questions, to give them in a nutshell what they most need to use and most need to know in language that's understandable. We also work a lot on advocacy, which has been especially important during the pandemic, as you can imagine. So that's working with people with disabilities and their families to make sure they know about laws and regulations and budget proposals and all kinds of things that can be happening at the state and local levels that are going to affect them, and then helping them stay engaged on making sure whatever those laws and policies and spending plans are going to be are good for them and other people with disabilities. So lots of meetings with legislators, helping people submit written comments, helping people virtually testify, those kinds of things. We have a whole transition points program because even though, like I said, most of the information we have, we try and keep really short, like 1 to 2 pages, because no one wants to read 800 pages as you saw through every issue. Sometimes it's helpful to do that. And so our transition points guidebooks are there at every stage of life. So early years in getting a diagnosis, navigating school, moving on to work and to home and to aging with a disability. And they're meant to be all of the big picture things that you'd want to navigate in that point in life in a one-stop shop. And it's divided into little chapters. So for example, if you look at the guidebook for people who are looking at graduating out of high school, it'll talk about waivers and trusts and Social Security and housing and all these little things. So you could take each chunk in and of itself if it's overwhelming to look at, but it's meant so when families come and say, like, hey, I need to know all the things we're supposed to know right now, it's there all together. And that's available online in English and 6 other languages, which are Mandarin, Korean, Vietnamese, Spanish, Arabic, and one that I'm forgetting. And some of them are also in Amharic. We have case management at our staff. So Sierra mentioned the support coordination that is provided by the Fairfax Falls Church CSB. We're contracted by them and some other neighboring CSBs, and we serve some folks as case managers or as public guardians too. So we've got a small team of social workers that does that. And we have a special needs trust that I'll talk about a little bit more in just a second. Essentially, so many of the programs that are critical for people with disabilities to get long-term supports, those programs like Medicaid and Waiver and Social Security, make it really hard for people to save money. And a special needs trust is a way that allows them to save money without losing eligibility for all those other programs. It's considered different than a regular kind of bank account. And we have a Tech for Independent Living program. And I'll ask you all to hop forward one slide and I'll talk about that a little bit more in depth. So our Tech for Independent Living program has been around for a few years, and it started with TravelMate, which is an app like on your phone or your iPad that helps people with disabilities learn to travel train and maintain travel training more independently. So it's set up for Virginia Metro's bus and rail system, and it's totally customized. So if someone's working with the person, they can set it up to geolocate and automatically pop up when the person gets near their own bus stop. And they can have a picture of the person next to their bus stop with the right numbers on it to make sure it's going to the right place. And it can link to maps, or it can link to charts or reward videos in YouTube when you board the bus, or whatever you want, whatever is motivating to that person. And what I really like about those programs is that it's picture or video footage of the person with the disability traveling, or in the case of EmployMate, doing something on their job. So when they have questions about it, they can certainly ask someone else and the app can help them navigate that too, or they can watch themselves doing it as a reinforcer for how to be more independent. And we've had a lot of folks look toward obviously tech-based options during the pandemic. And so a lot more folks doing this and expanding on these kinds of things. And we're working on rolling out SafetyMate for interacting safely with your home and community, and MoneyMate for more budget and kind of money management and money life savvy skills. Okay, next slide. And then I said I'd talk quickly more about the Special Needs Trust. Planning for the future has been a big topic during the pandemic. So our Special Needs Trust has been busting a move. They do tons of workshops every month, at least 3 every month, in small group and large group settings. Some are general, some are topic specific, to help people figure out, how do I plan for the future? How does saving fit in with if I want to leave a house to my loved one with a disability, or with my retirement as a parent, or with my desire to work as a person with a disability, and help people navigate all those things. And all of those workshops are free, and they do lots of free consultations to help people figure out what would make sense for them to plan and save for the future. Okay, next. And then here's just some of our information on how to stay connected with us. Looks like it's on my screen, it's still coming up. Okay, so during the pandemic, we are very web reliant. So the arcofnova.org is our website, and you can see a little picture of that on the iPad on the right-hand side of the screen. And at the very top, it says Information and Referral Portal. That's where you can put in questions and talk to me. And then right next to that is a director of providers. So all manner of providers, from attorneys to early intervention specialists, are in there. And then right next to that is our resource library. Like I mentioned, that has tons of 1-pagers and 2-pagers and quick guides for families. And then we're on Facebook, and folks can chat us on Facebook too if they have questions, and that's more accessible to them. And we're on Twitter, though we're not the strongest Twitter users. We're doing our best. And we are on LinkedIn. And then the last thing I wanted to share there is we're on YouTube, and we have, I can't remember the number now, 120 or so videos on YouTube. A lot of them are 3 to 5 minutes long, to give you a real quick overview of some of those basic topics, the same kinds of things we discuss in 1- and 2-page handouts. How do I get through this big idea quickly to to wrap my head around it. And then a fair number of them are more like half hour to an hour plus the more in-depth recorded webinars and sessions once you've wrapped your head around something and you think, okay, I'm ready to dive in a little bit more. Or I've heard this before and I've forgotten it, or I heard it before and it confused me. Can I listen to it more in my free time, which comes between 2 and 3 a.m. for so many of us parents, I know. But that's why it's online, right? Okay, and so I think we have one last slide, and our tagline is Achieve with Us. So we really encourage anyone with a disability and their family to feel empowered and to work with us to achieve whatever their life goals are. So thanks so much for having us today.
Thank you so much for that wonderful presentation. So now we're going to move on to our next segment of this presentation, and I would like to start with Lucy, Sierra, Sandy, and Melissa. What are some of the changes in adaptations that your programs had to go through during this pandemic to meet the needs of the people you're serving? I know some of you have talked a little bit about it, but if you could kind of tell us a little bit more about that.
I'll start. One of the things that we had to adapt to was obviously we have requirements that we have to see individuals either every 30 days or every 90 days. So learning how to achieve those face-to-faces via technology such as Zoom or Microsoft Teams, using technology and trying to figure out ways to ensure the health and safety of the individuals we support has been one of the major adaptations. The other thing is working with providers to provide them with resources to engage the individuals throughout the day so that they have meaningful activities while they're at home and not going to some of their day programs or out in community services.
I can go ahead and chime in for neighborhood and community services. I think obviously going to the virtual world and kind of navigating that has been one of the big things we've had to adapt to. But I think along with that, it's the recognition that with this population, virtual isn't the answer for everybody. So trying to figure out those new and different ways beyond in person and virtual that you can to engage individuals. So that's been one piece of it. And I think it's also been just making sure that we're at the table for all those other conversations that are going around about serving the community and making sure that there's a voice at that table also advocating for the specific needs of individuals with disabilities when it comes to what's going on. So I think that's been for us the biggest adaptation. The last thing would be helping individuals both with disabilities and older adults navigate using technology if that hasn't been something that they've been doing regularly, to make sure that if they are able to engage virtually that they have the means and the support in which to do it.
To echo what others have said, we moved everything online. So we used to do essentially all of our workshops and webinars and learning events, both live in person and online, so that we could record it and folks could join in a way that was convenient to them. And so we've just temporarily placed a hold on all those in-person things. So all our workshops are on hold. Our case managers and guardians have met virtually through web-based meetings or by phone with the individuals that they serve. Our trust team has done virtual consultations instead of in-person consultations. And a lot of the other piece that's been different for us is COVID brought a whole new set of challenges for people with disabilities to manage, obviously. So we've spent a lot of time in the last year making sure that we understand those and developing resources and ways to answer questions about COVID needs that are specific to people with disabilities and their families to help them navigate this. And then being available to people who need to talk with us, maybe instead of coming into chat, we're doing those on Zoom. We're just figuring out as we go and trying to be as accommodating as we can to make sure we're still getting folks information.
Great.
With the self-directed services program, I mentioned that we did put in some temporary policies in place due to COVID. And then I would say one of the other things that we've really had to adapt to is oftentimes our people that are using the services go to like day program type things like McLean Bible Church or Spark program, things like that. So those have not been open throughout the pandemic. So really it's been a lot of working with the families, and we actually have a very strong family group in our program. So that's been really helpful too. And just really trying to share information about ideas and just creative ways that we can still access the services based in the community, but in a way that is safe for the individual. So it's been a challenge based on the whole idea of the program, but it's working. So, and hopefully things will be opening back up soon.
Yeah, I'm sure families will appreciate that, and I'm sure they still appreciate what you're doing right now, because it's been really hard for a lot of families and their loved ones to be home and not being able to attend those programs in person. My next question is for Claudia, Sierra, Lucy, and Sandy. What is your agency doing to advocate for people with disabilities during COVID-19 and to promote community inclusion and engagement?
Go ahead, Sierra.
Okay, so for us, what we've been trying to do is we've been doing a lot of work with our community providers, our residential providers, to look at ways to modify the way they do things, limiting the number of people they're taking out to more one-on-one so that individuals are doing activities that they want to do, making sure that they're safe. Using Sandy's links and PowerPoints and sending them to support coordinators, families, and providers so that they have those options to use throughout the day to increase their community engagement. I think the other thing we've been doing is we've had more follow-up with individuals over the last year to ensure that they are maintaining their mental health, because we do want to be proactive. I know staying at home has been a challenge for everybody, whether you have a disability or not. So we want to make sure that we are kind of keeping an eye on everybody on a regular basis to ensure that we can support them prior to any kind of crisis occurring.
Thank you.
So the Department of Family Services has been working on a couple of things. We have been working really diligently on educating staff on how to accommodate. Now that, as the other members have talked during this panel, moving into a virtual environment, it requires so many other considerations that we haven't had to think about before. And so one of the things my unit is working on is just educating staff on the various assistive technology that's out there, things like live captioning like we have today, ASL interpretation, and how do we bring that into the digital world, just so that everyone has real-time intentional access to the resources that we as a county are sharing. We have also really put an emphasis on COVID-related resources through our e-news, Access Fairfax. So whenever we can, we pull from the county's website, specifically the health department's website, and then also the state and federal sites that are really providing almost hour-to-hour information on, information on the vaccine, COVID resources, things of that nature. So we try to push those out through the e-news. And recently, our department partnered with the Disability Services Board, which we actually provide staff support to, and we held 2 community conversations around COVID and the vaccine. And it was specifically, the audience was specifically individuals with disabilities, which was wonderful because we had questions. We had questions sent to us in advance, and we were able to really tailor the presentation to some of those very specific disability-related questions that the community has. So those are just some of the ways that we've really been trying to engage the community when addressing COVID.
Thank you, Claudia.
Go ahead, Lucy. I saw you unmute first.
I didn't pay attention to you first. So on the advocacy front, it's really varied based upon which department they were working with. So if it was folks just coming into the front line, so for example, we got lots of calls from parents saying my adult child lives in a residential home and we can't see them. What are our rights? What are our options? And so it was talking them through those kinds of things and helping them troubleshoot and problem solve, right? There were no magic answers during the pandemic at all. So on a case-by-case basis, we were working with folks with what they had going on and trying to help them figure things out. And our case managers and public guardians did the same, though obviously they work with those folks much more closely. So just like Sierra said with her team, working to figure out if those folks who used to go to a job during the day could have virtual employment or other kinds of virtual engagement. What were they? If they needed access to a device, how could we help them get a device to do that? If they needed access to more stable wireless, could we find a low-cost Wi-Fi plan? Those kinds of things. And then on the broader advocacy front, we've been advocating for laws and policies that favor people with disabilities and protect them during this time period. So for example, we had a bill passed that makes sure that if someone with a disability is admitted to a hospital, they can bring a support person with them if they need that person to help related to their disability, because we had a number of people coming to us saying, I'm worried that if I get admitted to a hospital, the policies say my parents can't come and my
table saying, don't forget about people with disabilities. What about the needs of people with disabilities? Have you thought about how this would affect people with disabilities? So really kind of getting that bug out there. So I would say that those are just some of the ways that advocating has been for people with disabilities has been key in our agency.
Well, thank you so much for those answers. And I do want to give enough time to the audience to submit their questions. So just very quickly, if what is that one thing that you want family caregivers to know about your programs or your organizations? Just one thing before we move on to our next segment, which is to let the audience submit their questions.
For DD support coordination, we are a long-term service. We are here to work with individuals from childhood to adulthood to support them in all of their needs throughout their life.
Mm-hmm.
For TR, I would say that, or NCS, we're here to meet community needs. So we're always open for input if we're not meeting your needs, and that I think the real thing would be that cost should never be a prohibitor to participating in our programs. There's always scholarships available.
Just say we're there and we're free to help families figure things out and troubleshoot about it, all manner of things. And like I said, you can't come to us too much. We're happy to help.
For self-directed services, I would say that it is a program that offers more flexibility than pretty much any program I've ever worked with. So people can really tailor it to be what is meaningful and beneficial for their family member.
Thank you.
For Disability Rights and Resources Unit, I would say that we are here to provide whatever resources we can through referrals. If we don't know the answer, we would be more than happy to research and to try and find some assistance for you.
Thank you. Thank you so much. So at this point, I want to move to our next segment, and I want to invite everyone in the audience to submit their questions. If you could write next to your question, who would you like that question to go to? If not, I'm going to start with the first one that was sent to us, and it says, how do we get access to the tech program? Is there training on how to use it? I think this may be for Lucy.
Oh, the Tech for Independent Living program. Great question. So we usually work with organizations. So a lot of folks are familiar with Spark and their community clubhouse. So in that situation, we have a grant that allows us to come out to Spark, and we'll train all the Spark staff on what it's like to work with this, along with the Spark individuals. And we'll work kind of in a big group to help them set that out. So if you're part of an employment or a day program group or a college studies group or an anything kind of group, those are most of the folks that we're working with now, and say we want to work as a group to bring this app to us and to figure out and set it up for all of us. And that seems to be way more successful than doing it one person at a time, right? Because then you've got a network of people around you using the same thing who can help you troubleshoot and adjust your app over time. So if folks are interested, then just reach out through that information and referral portal that I mentioned on our webpage, and you'll get me, but then I'll connect you to our Tech for Independent Living team who will look at their calendar and get the ball rolling. Great.
And I will be sending those slides, so don't worry about the numbers. So the next question is for Sierra. It says, is the CSB an entry point for the CCC Plus waiver screening?
We are not at this time, but we do work with individuals with the CCC Plus waiver. For children, you would want to call Coordinated Services at 703-222-0880. And then for adults, a department within the county adult services is the contact for the CCC Plus screening, and that's 703-324-7948.
Great. So the next question, I believe, goes to Sandy, and it says, our daughter Melissa, who is 29 years old and highly functional, is involved with the Tracers program and wants to become involved with a higher functioning group within Tracers. How does she do that? How do you get involved with a higher functioning group?
Well, thank you for the question. And Tracers is the name of our registration system. So that's where there's a variety of different programs. I would say the best thing to do is call our office. And what we'll have you do is have one of our managers who supervises the adult programs give you a call and talk to you and your daughter and see what her interests are, see what her independent level is, see what she wants to do, and connect her with the right program for her. In our social club model, there are kind of a stair step of programs for folks based on their independence level. So just call our main office and we'd be happy to connect you with the right program. And the other one I'll say on that, and I'm not sure if your daughter would be interested, but to make sure that I do throw a shout out there, that we do have our sensory room at Providence Community Center that is open and taking appointments, one-on-one appointments. So it's a great room for folks who are looking to get out in the community but want a clean space to do it. It's a nice one-on-one place to do that, and there's a staff there that coordinates. So.
Great. And actually, the next question is for you, Sandy, as well. It says, right, does NCS activities, do you just join the Zoom or register in advance?
Good question. So for the Virtual Center for Active Adults and the Project Connects, you can just join. For therapeutic recreation specific programs, there is a registration. It's a Zoom registration that we do right now. And those, as soon as our next round of programs are up, I think we're going to advertise this upcoming week, they will be on our main therapeutic recreation webpage. There's like a virtual program section now where you'll be able to get the links to register for the therapeutic recreation specific Zoom programs. But the other NCS ones, there is not, I don't believe, a registration that's required.
Mm-hmm. So my next question is for Lucy, for Sierra, and really for all of you. Do you offer any type of specific programs for family caregivers? I don't know, like support groups or consultations or anything that can help them?
Lots. So usually we don't offer support groups, but because of the pandemic and the incredible burden that it's put on families, we've been working with a partner in our office, Developmental Support Associates, to offer support groups on some Tuesday evenings each month. So I would say for folks to go to our website and on the events page or sign up for our Facebook or our e-newsletter to get updates. And like I said, those are free. But most of the workshops and the kinds of things that we have set up are geared toward parents trying to navigate resource finding or setting up a trust or any of those other kinds of things. And if a parent doesn't find what they need in an upcoming event, like by all means, let me know. I am thrilled to set up new workshops or new topics or direct you to one that we have on that topic that's already been recorded. We're always looking for new ideas on what families need. So ask about anything. And if you don't see it, definitely tell us what you need.
What about you, Sandy?
The Virtual Center for Active Adults does have a caregiver lunch bunch, which actually Juliana helps us with, or her group helps us with. That is open to caregivers. And then I will say that we have a family program, cooking program that we do. But that is one area that we would love to increase, and we haven't quite found the right formula for what parents or caregivers are looking for to engage them. So would love to talk to some folks who are interested in that and see what we could put together. There's definitely time on the calendar and staff resources available to support that. But we are on the VCAA, there is a lunch bunch specifically for caregivers that has some great topics.
Thank you. I don't know if Claudia, you want to add something to it?
Yeah, so the Disability Rights and Resources Unit does not provide any type of caregiver support group, but our partners that we contract with do. So for example, Brain Injuries, I know has a caregiver support group, which I sometimes go and present at. So just something to keep in mind.
Thank you. What about you, Sierra and Melissa?
We do not provide support groups.
Or
We
not
often
just specifically support groups, but it could be really anything else.
We provide DBHDS family trainings, information and resources for those families to learn more information. We also provide families with information for family trainings from our REACH program, which is our crisis program in Virginia.
Thank you.
We have a family support group for the caregivers who we contract with for the self-directed services program. So anybody who's in, it's a closed website, but anybody who's in self-directed services can be in this family group. And they're actually quite supportive with each other, especially throughout the pandemic, just kind of exchanging ideas and, bouncing ideas off each other about how to utilize community-based services without being unsafe in the community.
I see. And this will be just for family caregivers whose loved ones are in the program. It's not open to everyone. Okay.
That's correct. It's only for people within the program.
Okay. Well, thank you so much. We are getting ready to end today's presentation. The hour went by very quickly. And I want to thank all of you really for giving us your time and sharing your expertise with us. This has been very insightful and informative. And I want to thank all of you, our audience, for being here today and for all of your great questions. Before you leave, as I mentioned earlier, there is a brief survey. I just pasted a link in the chat box. If you could just take a moment to answer those questions, it really helps us offer topics that you're interested in. So if you could just take a few minutes and click on that link and answer that survey, we will really appreciate it. And again, thank you so much and have a great afternoon, everyone.